And Jim, the city of Philadelphia remains in the state's red phase despite some promising declines in cases recently. Philadelphia Health Commissioner Dr. Thomas Farley joining us not live now this morning to discuss the current situation in the city. Firstly, Dr. Farley, thank you so much for your time. We know just how busy you have been over these last several weeks. As we mentioned, we've been seeing a downward trend in the number of cases, but it still appears that the state is a long way away from the standard of 50 cases per 100,000 people. A lot of people eager to get back to work and to see things reopen. So what will it take for us to get there?
Well, all of us are eager to get back to work. We want to get people earn money, get money back in their pockets, and get our economy back there. First of all, the good news is that the worst appears to be behind us. The case counts are falling. Last week, almost every day, we were below 400 cases a day. This week, if we're lucky, we may be below 300 cases a day. But it's going to take a good bit more decline. The governor's benchmark he has out there is 50 cases per 100,000 over a 14-day period. It ends up being about 50 cases per day. So I can't tell you how long it's going to take us to get there, but it's going to be somewhere around there before we can really start to reopen things. And then when we do it, it'll be in stages. We need to do this very carefully because there's no question if we open too quickly, the virus will come roaring back.
And we know that you and your officials, health officials, have been keeping close count of the cases and the death toll in our area. We did hear Dr. Anthony Fauci, though, say that he expects the actual death toll to be much higher than the numbers that they've been getting. Do you think that's the same for our area as well?
Yeah, that's likely true, unfortunately, because right now we're just counting cases that are confirmed, where someone had a test done and a doctor knew that that patient died from the coronavirus. But there are people who may be elderly and chronically ill with other health problems. They may die, may not have that test. And only later on we find out that there's just an increase in number of deaths like that. So I can't tell you how many more deaths we'll be able to later estimate in numbers, but it'll be more than we're counting right now.
Now, as far as testing goes, what are the current updates for the city? And would you like to see the testing capacity increase beyond what we currently have?
I would definitely like to be able to increase the testing capacity. We have made a lot of progress, though. We have about 40 testing sites across the city right now. We've expanded our criteria, so anybody at any age who has symptoms typical of the coronavirus can go into one of those sites and be tested. We're doing about 1,500 tests per day. I would like to get up to 5,000 tests per day so we can find all those last remaining cases when our case counts get very low. And we're going to gradually get there, but it takes us to have more of the swabs available and more laboratory testing capacity. So it may take us a while to get there.
And something else that we've been hearing will be very key is contact tracing. How is the process coming along so far in this city, and how do you think it's going to help in terms of curbing this outbreak?
Well, the idea of contact tracing is to, when we have a case, and there aren't that many cases out there, to quickly interview that person and find out who they might have exposed and get to those people before they have an opportunity to get sick and pass it on to others and stop the chain of transmission by getting them into quarantine. That takes an awful lot of manpower and takes a lot of protocols in place. So right now we're putting those protocols in place. We're hiring some people. We're not there yet as far as putting that system in place, but as the case counts come down, that would be our goal, so that every person who has this infection quickly get someone speaking to them and identifying those contacts.
Now, as we look ahead and look forward to our region slowly starting to reopen, what do you think the new normal is going to be? What do you think every day is going to look like for people once they step outside their homes?
Well, one thing we can be sure, it can't just go back to be like we were before, because if we behave as we did before, the virus is going to come back, and it's going to come back as big or bigger than it has before. What I've said before is there's three main things people are going to have to get used to. One of them is wearing a mask. The other is keeping their distance from people. That means fewer crowds and just physically keeping distance from people. The other thing is washing your hands, so that if you get any of this virus on your hands, you're not going to get it into your nose or your mouth. The mask may be the things that people have the toughest time getting used to. It's not something any of us like to do. On the other hand, it makes a huge difference. South Korea has been able to do this with universal masking and follow these procedures. And the virus is not gone. It's still there, but it's at a low enough level that they've been able to keep their economy going. And that's the model we're looking for.
All right, Dr. Thomas Farley, thank you so much for your time, and we appreciate your hard work and the hard work of your colleagues as well.
Thanks for the chance to be here.
All right, take care.